Hi, my name is Patrice and this is my informative speech. Thank you for watching. This is my audience. Okay, today my speech will be on caffeine. Are you the type of person that wake up in the morning and yell for your caffeine? Or are you the type of person that think caffeine is too toxic for your body, so you go for a nice cup of water because you think it's just so bad? Well, let me first tell you what caffeine is. Caffeine is a crystalline compound that is found especially in tea and coffee plants and is a stimulant of the control of the central nervous system. So it's not really a good thing or it's not really a bad thing. It just depends on how much you use and how less of it you have in your body. And the National Institute of Health recent research has shown that coffee in particular may help prevent strokes and certain kinds of cancer. Now, it's not saying that it's a cure, but it can prevent it if you don't have it. It also can lower your risk of Parkinson's disease, and it boosts our concentration and memory. Just like all seeds, they're loaded with protective compounds. Some of the bad things that caffeine can do for your body is that it interact poorly with some of the medications, and which I'm sure a lot of people know, because once you're in a hospital and your doctor prescribes you with any kind of medication, and it always says to take with water instead of caffeine. Sometimes the caffeine can, not help the drug do what it's supposed to in your body. It can also worsen insomnia, anxiety, and heartburn. A researcher in the behavior pharmacy at the Johns Hopkins School of Medicine states that caffeine is a drug, which, yeah, it is. It's addictive and users become dependent on it, and it's kind of hard to stop. If you're one of the people that use caffeine on a regular basis and you want to stop, just don't stop cold turkey. These are some of the things that can happen once you decide to quit cold turkey. It can cause headaches, mental fuzziness, and fatigue. Some of the other bad things that caffeine can do for your body is it increases anxiety. So if you're one of the people that have anxiety attacks, might want to cut back just a little bit. It also disrupts your sleep patterns. It also increases your blood sugar level, making it hard for the type 2 diabetes insulin to start to work. And it slightly raises your blood pressure. There was a 2013 study by Harvard School of Public Health found that that people who drink 2 to 3 cups of caffeine a day prevents their suicide risk by 45%, possibly because caffeine stimulants help boost people's mood. So, in other words, caffeine can be good for you. Caffeine could be bad for you. It just depends on how much you use. You don't want to use too much in one day. Also, I found out that caffeine is not really healthy for pregnant women because it increases your heart rate and it's not good for you nor the baby. So I kind of cut back just a little bit. I still have maybe 1 or 2 cups a day. I'm not going to cut it out completely. It's cold turkey. I don't want the headaches and all the side effects that come with it. So as for me, on my regular day, I wake up just for a nice cup of water. But when you wake up and you're thinking about, should I get this coffee? Should I get this water? Don't think too hard about it. Just go with your mind. So that is my speech on caffeine. Thanks for watching. This is my audience.